The attachment theory can be defined as a set of concepts that explain the emergence of an emotional bond between an infant and primary caregiver and the way in which this bond affects the child's behavioral and emotional development into adulthood. The attachment theory is the result of the joint work from John Bowlby and Mary Ainsworth in the 1960s and 70s. Bowlby worked with delinquent children while studying psychology at Trinity College, which is what made him interested in child development. Ainsworth had joined Bowlby in his study on the effects of children being separated from their mothers. Bowlby originally focused on figuring out the particular relationships between children and their primary caregivers and how this influences their development and behavior later on in life. While testing his theories, Ainsworth formulated the concept of maternal sensitivity.
Attachment can be healthy and unhealthy. Healthy attachment can be noticed by mutually satisfying relationships, a child that is comforted by their caregiver, and emotional and behavioral management. Unhealthy attachment has many ranges. It can become severe enough that the child has reactive attachment disorder. So how do we know if a child has this disorder? There are many ways to tell. First, I should mention there are two main types, inhibited and disinhibited. Some common signs of inhibited are a child who is detached, withdrawn, avoidant, shuns relationships with everyone, and is unresponsive or resistant to comforting. A child who is disinhibited would seek attention from anyone, display inappropriate childish behaviors, and frequently ask for help doing things. We may also be able to see symptoms with relationships, behaviors and morals, emotions, and thoughts. So what exactly would cause an attachment disorder? There are many things that can cause unhealthy attachment. Risk factors for reactive attachment disorder are living in an orphanage, inexperienced parenting, frequent changes in caregivers, institutional care, extreme neglect, prolonged hospitalization, physical, sexual, or verbal abuse, extreme poverty, removal from neglectful or abusive homes, parents with mental illness, drug abuse, or anger management problems, and having a mother who has postpartum depression. Aside from the extreme cases, there are many parental behaviors that can cause unhealthy attachment. There are 5 different atypical parenting behaviors. Number 1 is withdrawal. This would be creating physical distance, such as directing the child away with toys and not greeting them on reunion. The second behavior is fearful. This would be using a haunted or high-pitched voice or sudden mood change. The third behavior is role confusion. Examples of this are pleading with the child, threatening to cry, and speaking as if the child were an adult partner. The fourth behavior is affective communication errors. This would be like contradictory signals like inviting approach, then directing the child away, and using a positive voice but teasing or putting the child down. The final behavior is negativity. Examples of this are mocking, teasing, hushing the child, or pushing the child away.
There are 4 stages of attachment that Bowlby focuses on. The first lasts from 0 to 6 weeks and is called the pre-attachment phase. During this phase, the infant's behaviors are supposed to promote contact with their caregiver, but they aren't attached to just one caregiver yet. The second stage, which lasts from 6 weeks to 6 to 8 months, is called attachment in the making. The infant then begins to focus on their preferred caretaker while favoring all caretakers over strangers. The clear-cut attachment phase, which lasts from 6 to 8 months to 18 to 24 months, is when separation anxiety occurs and stranger anxiety begins to form. The infant is now able to crawl or walk to their chosen caregiver, and they use that caregiver as a secure basis to explore their environment. The last phase is goal-corrected partnership, which lasts from 24 months onward. During this phase, toddlers see their caregivers as independent persons. They also develop a partnership or mutual appreciation and influence.
Indications of attachment. There is secure, insecure avoidant, insecure resistant, and disorganized attachment. Secure attachment is when the child becomes distressed when their caregiver leaves the room. When the caregiver returns, the child is happy and comforted. For secure attachment, the caregiver is a secure base for the child. Insecure avoidant attachment is when the child is unresponsive to their caregiver and is not distressed when they leave the room. When the caregiver returns, the child does not focus on them, but rather the environment around them. Insecure resistant attachment is when the child tends to stay close to the caregiver and is distressed when they leave the room. After the caregiver returns, the child tends to be anxious, clingy, and resistant. Finally, disorganized attachment is when the child shows confusion and contradictory behavior when they are reunited with their caregiver. The child may cry out unexpectedly or appear dazed and depressed. There can be many reasons why attachment disturbances may occur. A few examples of these are maltreatment in foster care, post-institutionalized and inter-country adopted children, and divorce in child custody. There are many things that can cause a child to have attachment disturbances while in foster care. One thing is that children are likely to be classified as disorganized from their maltreating parents. There are times when disorganized attachment has been as high as 90%. Another cause for disturbance is the child has to repair the attachments from their biological parents, all while they are trying to make a new attachment to their foster parents. Studies have found that 1/3 of children between the ages of 1 and 4 that were taken from their parents and placed in foster care had little to no attachment 3 months after they were placed. Studies have also found that once the child was placed in a new home, that attachments began to organize as secure, avoidant, or resistant within weeks of placement. Children that are placed in foster homes before 10 months develop secure attachments to their foster parents, while children who are over 10 months were likely to show insecure behavior when distressed. Attachment disturbances are most common in the post-institutionalized and inter-country adoption of children. Even after the child has established an attachment to their adoptive parents, some still continue to show high levels of indiscriminate behavior. Parents need to know what the child needs regardless of the off-putting signals, so that the child may remain comfortable. Parents of the adoptive children can also look at their own attachment history to inform themselves of their parenting behaviors. Regarding divorce, there is still a widespread confusion about the relevance of the attachment theory. Once a child has an attachment to a parent, any visitation with the non-custody parent will likely involve separation from the primary attachment figure. While having overnight visits for children that are younger than 2 or 3 can harm the attachment to the primary attachment relationship, but can also make it difficult to establish a healthy attachment to the non-custodial parent. A child might not be able to maintain attachments to different adults that live apart. The level of parental conflict is likely to increase the chances of attachment disturbances in young children. If there happens to be high levels of conflict and violence, it could threaten the attachment relationship even more. When looking at attachment, what can we do to help it? There are some attachment-based interventions that can be used if needed. These include children-parent psychotherapy, video-based intervention to promote positive parenting, the circle of security, and attachment and biobehavioral catch-up. Child-parent psychotherapy is used for impoverished and traumatized families with children under the age of 5. The sessions for child-parent psychotherapy can include both the parent and child and can take place either in-home or at an office playroom. The sessions are uninstructed and the parent and child determine what happens during it. CPP is used to enhance emotional communication between parent and child. This happens by the parent exploring links between their early childhood and their current feelings toward their children. The link between CPP and the attachment theory is the emphasis on emotional communication. Video-based intervention to promote positive parenting, or VIPP, is used for lower-risk families. VIPP is a 4-home visit attached intervention that is for parents of infants that are less than a year old. It was drawn from attachment research and attempts to promote maternal sensitivity through videotaped infant-parent interactions and written material. Aside from VIPP, there is also VIPPR. This is an additional 3-hour home visit that focuses on the parent's childhood attachment experiences.
The Circle of Security intervention is designed to help caregivers increase their awareness of their children's needs and whether their responses meet those needs. The CDs use both graphics and video clips. Aside from the DVD training option, there are also 20-week group sessions, family therapy, and home visitation.
Another type of attachment-based intervention is called Attachment and Biobehavioral Catch-up, or ABC. ABC consists of 10-session interventions aimed at reducing barriers to the development of secure attachment. ABC shows that there are 4 major areas that caregivers will face with foster children. First, young children in foster care might reject the care that is offered to them. Second, the caregiver's own history could interfere if they're providing nurturing care. Third, children in foster care might need special help with self-regulation. Finally, young maltreated children might be sensitive to frightening behavior in caregivers. ABC also has 4 treatment methods. These are following the child's lead, personal nurturance, overriding one's own history or non-nurturing impulses, and avoiding frightening behavior with the child. During an ABC session, they used videotaped examples to show interactions between children and foster parents. They can also do live interactions between the parent and child to get a better understanding.
Attachment theory is not only in effect with children, but it is also in effect with adults. It's no question that Bowlby's main focus was to understand the nature of the infant-caregiver relationship. With that being the case, he still believed that attachment impacted human experience from birth until death. In 1987, Cindy Hazan from Cornell University and Philip Shaver from the University of California were the first 2 researchers to explore attachment theory in adulthood. They focused on this primarily in the context of romantic relationships. Hazan and Shaver noted the same features that infants and caregivers had in common with romantic adult partners. These features were that both feel safe when the other is nearby and responsive, both engage in close, intimate bodily contact, both feel insecure when the other is inaccessible, both share discoveries with one another, both engage in quote-unquote baby talk, and both play with one another's facial features and exhibit a mutual fascination with one another. Based on these findings, both Hazan and Shaver argued that adult romantic relationships are attachments and that romantic love is a property of the attachment behavioral system. When talking about the idea that romantic relationships are attachment relationships, there are at least 3 critical implications of this idea. First, if adult romantic relationships are attachment relationships, then the same kind of individual differences in adult relationships should be observed like they are in an infant-caregiver relationship. Second, if adult romantic relationships are attachment relationships, then the way adult relationships work should be similar to the way an infant-caregiver relationship would work. Lastly, whether an adult is secure or not in their relationship may be a partial reflection of their experiences with their primary caregivers. But the real question is, do both relationships work in the same way? According to Hazan, adults that are seeking long-term relationships look for caregiving qualities in their potential partner. These qualities include attentiveness, warmth, and sensitivity, and are considered the most attractive qualities in a dating partner. The secure pattern of attachment in infancy is universally considered the most desirable pattern by mothers. In infancy, secure infants tend to be the most well-adjusted, in the sense that they are resilient, get along with other infants, and are well-liked for the most part. When researching adult attachment, the same kind of patterns pop up. For the most part, secure adults tend to be more satisfied in their relationships than insecure adults. Their relationships are based upon by a larger level of longevity, trust, commitment, and interdependence, and are more likely to use romantic partners as a secure base from which to explore the world. Secure adults are also more likely to seek support from their partners when they are upset. Based upon that, they are also more likely to provide support for their distressed partner if they are secure.